Chapter 38 covers the anti-diabetic drugs, including insulin and oral and other sub-Q agents. With more than 34 million Americans having a diagnosis and living with diabetes, it is anticipated that you will take care of many of these patients during your career as a nurse. So understanding these drugs and how they work are going to be key to your helping these patients manage their care. The insulin prototype is found on page 642, and the insulin type 1 diabetes critical thinking scenario is found on 644. Please read this and review it because it gives you good information on what you need to teach your patient who is a diabetic. Let's talk about the insulins. They come in 4 categories based upon their onset, peak, and duration. So you definitely need to understand the differences in the onset of these drugs so that you understand when they are used. The different drugs are listed, for example, under rapid-acting Lispro Aspart and under regular Humulin R and Novolin R based upon the company that makes them. So they have a different drug name based on the company, but they act the same way. The rapid-acting insulins have an onset of 5 to 15 minutes. Therefore, this drug needs to be given no more than 5 minutes before the patient ingests their food, while regular insulins have an onset of 30 to 60 minutes and can be administered up to 30 minutes before the patient eats. Intermittent insulin, or NPH, has an onset of 1 to 4 hours. It is commonly given in conjunction with a regular acting insulin to provide a more prolonged and level blood glucose management over the course of the day. The long-acting insulins are Garglin and Detamir. Their onset is 2 to 4 hours after administration and have either no or a relatively peakless duration so that the blood glucose control remains the same over the 24-hour period. Long-acting insulin is very beneficial to a patient who needs to travel long distances, for example, by airplane across the country or overseas, where they cannot easily carry insulin syringes and multiple needles with them on their trip. The drug also has the advantage of being evenly distributed over that 24-hour period. It is also given at the same time every day. So you may get a patient into the hospital who takes a long-acting insulin in the morning or one who takes a long-acting insulin in the evening. It will be important to know when they take their insulin so that it can be scheduled on the same schedule while they're hospitalized. All insulins have hypoglycemia as an adverse effect, so monitoring blood sugar frequently while the patient is on insulin is extremely critical to their care. In addition, regular insulin can be used IV in an emergency when the patient has an extremely high blood glucose level that needs to be brought down. The adverse effect of that would be that it is brought down too quickly because it does act really quickly when given IV, and therefore blood glucose needs to be monitored carefully while the patient is on an IV insulin. Note that when mixing regular and NPH insulin in the same syringe, you can mix it in the same syringe, but you must give it within 15 minutes of combining the 2 drugs. You need to review the box on cultural variations and the box on herbal therapies because many herbs interact with insulin to provide a side effect of hypoglycemia, so they can't get used together. Also, on page 640, let's look at box 38.5 about the different insulin delivery methods. Sub-Q insulin injection is the primary delivery system. Remember that you must rotate the sites and of insulin delivery. In your Lippincott photo atlas of medication administration that came with your textbook, you will find on page 24 the skill set of mixing 2 vials from 1 syringe, which describes and shows how insulin can be mixed. and skill set 7, which is on page 34, how to administer a sub-Q injection. And I know you had a skills test that you assignment that you had to turn in, but this is another good helpful hint, and actually shows on page 33 the locations for administering a sub-Q injection. So teaching the patient where to administer their insulin will become a very important part of your teaching of a diabetic patient. Other insulin delivery systems include the insulin pen, where the patient dials the amount of insulin to be given and injects it subcutaneously. This is an advantage for individuals who need insulin 2 to 3 times a day but can't transport lots of syringes and needles. It is also important to teach the patient correct administration, and that they must rotate that syringe 15 to 20 times before injecting the insulin to disperse it. This type of insulin delivery, the insulin pen, is also advantageous for individuals who cannot have poor vision and can't read the little lines on the syringe, so they can actually dial the amount of insulin in the pen and ensure that they're giving themselves the correct amount. The external insulin pump can be worn on a belt or hidden, and it injects a basal rate of insulin into the abdomen all day. And then the patient can inject a booster dose throughout the day that corresponds with their carbohydrate and diet intake or their exercise changes. The problem with this insulin delivery is that it has an increased risk of infection, requires frequent changing, and the supplies need to be ordered. So focus on that safe administration. There are some extra insulin information from the American Diabetic Association. You will learn more about diabetes, insulin, and oral agents when you are taking your med-surg course on diabetes mellitus. Please note that insulin is the drug of choice for individuals who are pregnant or who are breastfeeding, because insulin is destroyed by the gut and does not enter the breast milk. Also note that individuals who take insulin and use a beta blocker need to identify other ways to notice if they are having a hypoglycemic event. Because the beta blocker blocks the sympathetic nervous system, it also blocks the signs and symptoms of hypoglycemia. There are many other drugs that interact with insulin, and in the clinical setting, verification with another nurse is required. Glucose levels increased with stress, infection, and the use of steroids, so more insulin is often required in these situations. Also, the individual who is being managed with an oral agent and has type 2 diabetes may require insulin use during a period of stress, illness, or when they are on steroids, and you need to be able to explain this glucose level need while to these individuals. The hemoglobin A1C is the lab test that estimates serum glucose levels over time, and that's usually over a 3-month period, and it is used to monitor the effectiveness of the treatment of type 1 and type 2 diabetes. The oral and sub-Q drugs that are used to manage individuals with type 2 diabetes are the last ones that we'll talk about. A second generation sulfonylurea, their drugs are listed here: glimepiride, glycepride, and glyburide. They bind to the potassium channels on the pancreatic B cells to stimulate the pancreas to release insulin. Type 1 diabetics would not benefit because they do not have functioning beta cells, so these drugs are used for type 2 diabetes. Note that all of the type 2 diabetes drugs must be combined with exercise and diet changes in order to be effective. These drugs can also be used with insulin or with metformin to manage blood glucose levels. Do not use these in pregnancy. And be cautious of the individual who is on a beta blocker, because again, the beta blockers mask the hypoglycemia. They are also safer for individuals with renal dysfunction than some of the other agents. Metformin is a common drug that is used to manage type 2 diabetes. It decreases glucose production and increases glucose uptake in the cells. It also decreases the postprandial or after meal hypoglycemia that we all have when we are after we've eaten. The advantage of metformin is that it does not cause hypoglycemia typically. The problem though with this drug is that if you are giving it to an individual who is going to undergo a procedure where they use contrast dye, the metformin must be discontinued 48 hours prior to using to having that procedure because of the impact on the kidneys. So individuals also need to be monitored for BUN and creatinine. Metformin is the oral agent that is approved for children 10 years or older. A sub-Q drug that is used to manage type 1 and type 2 diabetes is pramlintide. It delays gastric emptying, reduces postprandial blood glucose, and it triggers satiety in the brain, which decreases the individual's appetite. When used with insulin, however, it can cause severe hypoglycemia. It is a rapid onset, so it needs to be administered right before or right after a meal, and if used with insulin, cannot be mixed in the same syringe. Exenatide is another agent that is a sub-Q agent. It is given BID within 60 minutes of a meal. It increases insulin secretion in the pancreatic cells, and it delays gastric emptying and also reduces appetite, because if the stomach does not empty, then you feel full longer. It is used for type 2 diabetes. The problem with this drug is severe abdominal pain. While it does not often cause hypoglycemia. Liraglutide increases insulin secretion, suppresses glucagon, and it delays gastric emptying and decreases appetite. It is another sub-Q drug that is given once a day. A common side effect is abdominal pain and pancreatitis, and it can lead to thyroid C-cell tumors. Hypoglycemia is uncommon. In this drug, the GLP-1 agonist, we must monitor the individual for pancreatitis, so that severe abdominal pain would indicate that the patient may be developing that. Sitagliptin slows the breakdown of GLP-1, and that leads to more insulin being released by the beta cells. It decreases glucagon release, and it slows GI absorption of glucose. It is used for type 2 diabetes. It is an oral agent that is given once a day, usually in combination with some other agent. There are many side effects, including hypoglycemia, and GI can cause acute pancreatitis. The last drug is a hyperglycemic hormone, glucagon. It is released from alpha cells, and it decreases insulin release and accelerates the breakdown of glycogen in the liver. It is used to counteract insulin-induced hypoglycemia when other methods of giving glucose are not available. So for that individual who's having a hypoglycemic event but can't drink their juice or eat their protein snack, then this would be a drug of choice. It is available in IV, IM, and sub-Q. The blood glucose will rise within 10 minutes. The patient needs to be placed on their side if their level of consciousness is decreased when administering, because it does have the risk of vomiting, and you want to protect the patient from that. So pay attention to these drugs, the method of which they are given, whether they're sub-Q or oral, and their major side effects for these drugs.